This hospital is the last chance at survival for these AIDS patients in the Central African Republic. Around 110,000 people here have HIV, the virus that attacks the immune system. But a lack of testing means many sufferers are not counted. This community hospital is the only one dedicated to caring for patients at an advanced stage of AIDS in the capital Bangui. The hospital has 68 beds and a further 15 for intensive care.
Our mortality rate is between 10 and 15%, which is not bad, frankly, given the severity of the conditions in which our patients arrive. We have patients who die the same day or sometimes within a few hours of arriving at the emergency room. This is one of the only countries where there is no free HIV testing, so patients learn of their HIV status very late, when they are already in an acute condition.
An HIV test costs around €4. But almost 70% of the population lives below the poverty line, according to the World Bank. That is €2 a day. Meanwhile here, treatment for HIV patients is free. Many suffer from tuberculosis. After living unknowingly with HIV for years, patients have very little resistance to infections.
I was extremely tired and exhausted. When I arrived at the hospital, I had no appetite or strength, but now the tiredness is starting to disappear, and the appetite is coming back. I feel a bit better about my body.
While this young man is still at the beginning of his antiretroviral treatment, this woman has already come a long way. She says she owes her life to the hospital, which is supported by the humanitarian group Doctors Without Borders, known as MSF.
I know that if I had not been able to come to this MSF service, I could have died. Today I am healthy. I take my medicine, and I can even run my small business.
But outside the hospital, HIV sufferers face another uphill battle: social stigma. Widespread hostility forces them to hide their status. Countries around the world have launched awareness campaigns, but in Central African Republic, there is little public information.